Hello, everyone. Welcome back. Another episode here of COVID-19 update. Just talk about a few things before I get into the numbers here. Um, I'll talk about some of my local issues here where I am. And I recently did go to Harbor Freight. I went there for different reasons. I went there to pick up some gloves because we're kind of running low on gloves, especially for my wife. She's a size medium. I'm conserving my gloves. I'm actually reusing them quite a bit. I'm washing the gloves while I'm wearing them, like washing my hands, and then taking off the gloves and washing my hands again. So trying to reuse the gloves because they're hard to get. So I went to Harbor Freight and they have a very limited supply of gloves. I understand that they're also donating the gloves as well, but I noticed that they don't have the coupons for the gloves. So, anyways, that's fine. I bought quite a bit. Hopefully, they will last. I bought a lot of mediums, so hopefully they'll last. They may have donated it. Harbor Freight may have donated the gloves, but also they may be running out too. China's going through a resurgence in Beijing, so again, it could be a supply chain issue as well. And also the employees at Harbor Freight are now wearing masks. When I go, I do wear my whole setup. I wear my mask setup, and I think that's sufficient for now. I'm still using the same N95 mask, so just trying to protect that as much as I can. I have like maybe 4 or 5, maybe 7. So, but haven't gone through all of it. And plus, I have my half mask from Harbor Freight. So, and that I think that same day or maybe a day after, I saw my first COVID-19 drive-through. It was at my local HEB when I went grocery shopping. Um, it was empty. It's appointment only, and I think it's by UT Physicians, University of Texas Physicians, or University of Texas Medical Care, or something like that. So COVID-19 is real. The drive-throughs are real. The one I went to is by appointment only, so I guess if you're in that medical network system, um, you're able to take that option. I know some other places have done drive-through for the general public. They're usually set up around like high schools or middle schools or some public places. But that was my first time I've seen it. I also saw a little sign for BLM fundraising, Black Lives Matter fundraising. Uh, when I looked around, I didn't see anybody actually fundraising. I just saw the sign. So, I don't know what that means, but I'll throw that in there. Also, in my area, there was a Chick-fil-A. All right, there's a Chick-fil-A that is closed now. 4 employees were confirmed to have COVID-19. Yes, the Chinese coronavirus, the Wuhan flu, CCP virus. That's what they got. So they shut that Chick-fil-A down for about a week. They're sanitizing it. I don't know if they're going to reopen or not. I assume they will be reopening, but just the fact that, you got people, when you think about food, the food industry, a lot of it is very low wage or barely minimum wage, barely livable wage, and often they're employed with very young or minority or immigrants. Sometimes, you can just tell just looking. When you go to your McDonald's or Chick-fil-A, you look at the people making your food. That kind of gives you an idea of the demographics. So, anyways, yeah, Chick-fil-A closed for a week. 4 people infected with COVID-19. They've been serving food all this time, so be careful out there. Another thing is where I live, the county I live, Fort Penn County, their 7-day average is at an all-time high, at an all-time high. And I'll kind of talk to you about that. Let's go to the local. I'm going to go to the local area. So here's my local area, and 2,951 confirmed in the county. Supposedly the 7-day average is at all-time high. I live in this area code right here, is this zip code area, and numbers gone up. Numbers gone up. 330 confirmed cases. Is that a lot? Is that devastating? Well, it could be worse. It could be worse. And so I'll go over the numbers real quick here. I just want to show you that. And also, you know, in other places in the country, okay, and then let me go to the different, let me go here. Other places in the country, Arizona has really seen a spike in these cases. Um, I I think what's happening is, as we're opening, our social distancing, you know, is becoming less, I should say. Our social interactions are and social contact are increasing. And so that's why you're seeing the insurgence. So let me just show you some of the numbers here we'll go over. This is for US statistics. Total cases, 2.2 million, 2.2 million. The increase in today, just today, new cases, or I should say, what is this, June 20th? This is for June 20th. It's still, I'm recording this actually June 21st, 2020, 8:15 a.m. I'm doing this in the morning. But this was what, Saturday, 32,000 confirmed cases, 559 total deaths. So yes, you're getting increases in cases. Matter of fact, you see this little tail end start to point upwards. But if you look at this map on the bar graph, you see it was coming down. It was going down, and then you saw a bottom, and then now you're seeing an increase. And I think that has to do a couple things. Possibly the protesting, the rioting may be a contributing factor, but also just in general, I've noticed when I'm driving around shopping and getting stuff, getting supplies, groceries, I notice more traffic, more car traffic. So I think people are starting to go back to work. My wife actually goes to work now, or she's been working, but she's actually has to go physically into the office, like once a week or something like that. So more people are going to a physical location to work now, and so you're probably going to see more cases, and plus there's more testing available. But this is a little alarming. But I also think a lot of it is basically the younger demographics, younger age, who can probably handle the infection and probably won't die. And you're kind of seeing that in the numbers here, as you see right here. California, wow, 4,000 in California, 4,000 in Texas confirmed. That's quite a bit. 4,000 in Florida. So you're seeing increases in numbers. But let me take a look here overall. So Saturday, 6/20/20, 32,000, quite an increase. Friday, 31,000, that's an increase. But look at the death. I know the death will lag a little bit, but you're looking at 595 deaths on the 20th, 692 deaths on the 19th. So I think the vulnerable population, the virus just went through all the vulnerable population. Now the virus is kind of going through the younger population, the demographics of the younger population, and it's not that bad. People are surviving. Another thing I want to go over is Brazil. Let's go to worldwide. Let's take a quick look at that, if you'll let me. So worldwide, you see an increase. So worldwide, it never stopped, and Brazil has reached 1 million. 1 million. So I want to keep it really simple, real easy. Let's go to the IMHE numbers, and you'll see that they are expecting the deaths to go up September 1st. All right, so like I said, during the winter, I think you're going to see an increase, fall and winter. Anyways, I'm going to conclude this episode, so feel free to like, dislike, leave a comment, and please subscribe. Bye.